So you want to know how to use cash for doctor visits? Well, in this video, you're going to learn all about how to use cash for doctor visits and why you should. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. If this is your first time on the channel and you like to get fact-based healthcare information, please hit the subscribe button for me. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start sorting fact from fiction. So let's drill down a bit on cash pay healthcare and its many benefits. So these are some of the reasons why cash pay services are increasing in healthcare. Doctors are increasingly burned out and retiring. Many doctors are avoiding certain health plans as well as avoiding Medicare and Medicaid because of their burdensome rules. Even better, with cash pay services, practitioners can avoid all these administrative burdens, cut overhead, and have better cash flow. These features increase the value of their practice. So what are some of the benefits of cash pay healthcare for consumers? There are several benefits for cash pay healthcare for consumers. You're not restricted to provider networks. You can choose any provider, lab, or imaging center. There are potential discounts if you make it abundantly clear you are paying cash. And discuss this directly with the office manager or the doctor, as the front office staff are generally clueless about cash pay, and if doing cash pay, do not give the office your insurance information. Be sure to inquire about the discounts for cash payment before you commit to a visit, and shop around. Cash pay also eliminates all the other restrictions and barriers to healthcare access, such as the need for referrals and approvals. It also allows you to make independent healthcare decisions and keep them private and away from the insurance industry. As well, cash pay visits may be favored with priority access, so you can be first in through the door. So not only do cash pay healthcare services have benefits for the consumer, but they also have benefits for the practitioner. The benefits for providers: they avoid all the office work for referrals and authorizations, as well as all the complex coding requirements. And they avoid claims filing burdens or claims challenges and get rapid pay. Payment concerns are important to all practitioners, as most, if not all, practitioners are on production, and the more patients they can see for cash pay, the better it is for their cash flow. So why is cash pay healthcare becoming more common? So there's an increasing demand for cash pay healthcare because healthcare premiums are rising and high deductible health plans are more affordable, and employees and consumers are moving towards these more affordable, high deductible health plans. Physicians prefer cash pay as it bypasses the office administrative work, as well as avoiding claims filing challenges and significant overhead. Cash pay is by far much more convenient and efficient than trying to get your health insurance plan to pay. Certainly, all office-based care is routine and generally affordable and should be all cash pay. So before undertaking a cash pay healthcare service, you should do a little homework. Let's have a look. So before you start calling up doctors to ask for their cash pay pricing, you should do a little research first to see what sort of cash pay prices are accepted for the service you need. Also have some idea of what insurance pays for that particular service. Now, the cash pay pricing should always be less than what the insurance company pays for your particular need. By the way, I recently searched for some cash pay prices for an MRI of the knee, and it ranged from $300 to $4,000. Clearly, it's a jungle out there. And when trying to get cash pay pricing, forget about talking to the front desk or scheduling people and instead talk directly to the office manager or the physician concerned. If you haven't seen this particular provider before and you want to consider a test or treatment by that provider, it is highly likely that the particular practitioner will want to evaluate you first to be sure that you actually need that particular test or treatment that you are seeking. Also, if payments are a bit more than you can handle, you can always ask about payment plans. But you say, I have insurance, so why should I be concerned about cash pay healthcare? So here are some of the reasons to ask doctors about their cash pay healthcare services. If you have a high deductible health plan, you're going to be paying cash till you meet your deductible. Also, many health plans have non-covered services such as dental, vision, and mental health, or you want to see providers who are not in your plan's network. And there are other tests or treatments you may want to have that are considered experimental or investigational by your plan. As well, you may want an alternative medicine treatment, and many plans will not cover alternative medicine. Or, commonly, they won't cover any cosmetic needs you may have. Finally, some patients want to keep their services confidential and not share information about their visit with their insurance plan. So let's take a quick look at some of the pain points that you're going to have to deal with if you decide you're not going to use cash to pay for a routine office visit. So let's look at some of the problems and pain points to healthcare access when using insurance for routine office-based care. Having to deal with complex rules and restrictions, the need for referrals, getting denials, appointment scheduling delays, opaque pricing, and surprise bills. Everyone is well aware of these frustrations with healthcare access. So millions of consumers have high deductible health plans, but most never meet their deductible. Let's figure out why they never meet their deductible. So more and more people and employers are using high deductible health plans as these plans are much more affordable. Let's look at the health insurance deductibles versus what most individuals pay for care. Now, the average deductible for individual employee-provided insurance is about $1,787. The average cost of an urgent care visit is about $150, and the average number of doctor visits per year for most people is some 3 or 4 visits, so that 4 visits is about $600, and obviously much less than their deductible, and this makes it quite clear that most people never meet their deductible and pay more for insurance than they pay for care. However, at least it covers you for major medical needs. So how much of all the health care delivered is generally affordable routine care? So why is cash pay healthcare important? Because some 80 to 90% of all the healthcare delivered is generally affordable routine office-based and outpatient care. Having practitioners file claims for routine office-based care causes practitioners to have practice overhead of about 60 to 70%. As well, the millions of people on high deductible health plans mostly never meet their deductible and cash pay for all of their routine care. In fact, most of the health care that you will ever need is routine, generally affordable office-based or outpatient care and not in-hospital care. And health insurance should be reserved only for major medical needs and not for routine office-based care. So if 80 to 90% of all the health care delivered is generally affordable routine office-based and outpatient care, how can a digital health platform help? So the digital health platform helps practitioners avoid red tape. It cuts the 60 administrative overhead. It's cost transparent, provides rapid pay, and combats office fraud. It's convenient, efficient, and a provider dashboard can assist with practice management tasks. Let's see how Digital Health Platform benefits consumers. Digital Health also has great benefits for consumers in being open access and without all the burdensome need for referrals and authorizations. It avoids all provider networks and you can see who you want. It's cost transparent and there are no surprise bills. Again, it's highly efficient and convenient. Let's see how digital health benefits employers. So digital health has several benefits for employers and employees. It facilitates healthcare access for those with deductibles. It's useful for those with health savings accounts. There's less red tape and administrative processes are minimized. As well, it's highly convenient and efficient. Also, the employer dashboard allows for some health benefit administrative services. Let's take a quick look at an example of a digital health platform. So this is HEALTHdrum, a cost-transparent direct-pay digital health platform that allows anyone open access to high-quality and affordable routine office-based and outpatient care without barriers. At this time, the platform provides hassle-free access to those in South Florida only. Remember that if you are looking for a particular service but haven't been seen by that particular practitioner, you will need to schedule an initial visit so that the practitioner can be sure that they agree with your need for a certain test or procedure. And what can you do to stay healthy and minimize doctor visits? So to avoid doctor visits without ignoring your health, eat healthy, maintain an ideal body weight, get regular amounts of moderate exercise, avoid drugs, smoking, and minimize alcohol. Avoid stress and get quality sleep and live with purpose. And you can get more info at HEALTHdrum.com. So let's recap. In this video, how to use cash for doctor visits, you learned that cash pay for healthcare is perfectly legal. You can use cash pay despite having insurance, and cash pay is often cheaper, more convenient, and more efficient than using a plan. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.